go ahead and get started with our last session for today in Horizon. We're going to be learning about international development, and Jeff Kaplan will be our moderator for our panel today. Thanks.
Thanks so much, Claire. Thanks everybody for joining us. So as I think everybody saw, the kind of theme that this panel is going to tackle, we're going to tackle together, is the idea of sort of in the international context, and particularly focused on the work of nonprofits in that. And everybody with me here represents a different kind of nonprofit. This idea of sort of open data, and data in particular having impact beyond a website. The idea is, it's not really about a portal, as often people end up talking about, because it's the thing people see, but it's really about data having impact in people's lives, having impact on organizations. And that's sort of the way we're going to approach the panel together today. And I'll introduce everybody in just a second and let them really sort of do a further introduction of themselves. But just to say I would like to do together with everybody is, along that theme of sort of data having impact beyond just a website, sort of beyond the portal, giving each of the folks up here with me a chance over 3 or 4 minutes to introduce themselves and sort of a first quick take on their organization's experience with data having impact. And then we'll do a sort of a Q&A together among the panel, myself sort of asking them a couple questions. And then we definitely would like to sort of open up so that if there's questions from all of you or comments and make it a little bit more of a dialogue. And so let me just, without further ado, introduce very briefly, before I ask them to introduce themselves, this great panel we've got here. So we've got Jessica Robbins, who is with an organization called the Global Island Partnership. She'll explain what that is in a minute. We have Adi Ayel, who runs an organization called Code for South Africa. That's a civic technology group based in Cape Town. And then we have David Saldivar, who is with Oxfam America. And without taking up any more time, because I know we're going to end up filling all the time we've got, what I'm going to do is ask each of you in turn to sort of take 3 or 4 minutes. I think each of you has some visuals that you want to share along with that, and really just sort of introduce yourselves, the organization, and sort of take a first cut at sharing along this idea of sort of data having impact and what that means for your organization, what that means for the work you're doing on the ground. That's sort of where we're going with this. So I think, Jessica, if I'm not mistaken, yes, we have the ordering kind of right.
Yeah.
The floor is yours for a handful of minutes.
Okay, great. So thank you very much, Jeff. So as Jeff mentioned, my name is Jessica Robbins. I'm originally from Tasmania, Australia, and work for the Global Island Partnership. Hence, I've always had a passion for islands, being from an island. But anyway, so the Global Island Partnership is a partnership co-chaired by the presidents of Seychelles, Palau, and Prime Minister of Grenada, each 3 very beautiful countries. But each of those leaders are also really committed to conservation and really advancing sustainable development within their countries. What happened around about 2005 is that during a big global meeting focused on small island developing states, the then UN Secretary General actually said, look, we need greater collaboration, to make any sort of sustainability objectives work. And the presidents that I mentioned previously came together and said, look, let's form a global partnership really focused initially on conservation and sustainable livelihoods, but now in this day and age of the Sustainable Development Goals and a realization that for conservation to really work, you need to see that at the heart of resilience, not the other way around. They developed a new mission, which is really around how to build resilient and sustainable island communities, specifically really through setting really strong goals around what they meant by sustainability. So back again in 2005, the President of Palau, along with a number of leaders in that area of the world, committed to conserve 30% of their marine and 20% of their terrestrial areas by 2020, which in 10 years ago, and actually even still today, it's a very progressive conservation target to have set for your country. As a partnership, we help to create a platform for those leaders to actually announce these sorts of commitments and inspire other leaders to also adopt really progressive targets. So most recently, about a year ago, the state of Hawaii actually adopted 6 statewide sustainability targets known as the Aloha Plus Challenge, which is a really groundbreaking model of green growth and a really great groundbreaking model as well of engagement in establishing these targets. So essentially that's, as a partnership, there's around about 70 plus countries, organizations and entities that are really focused on how it is that we can support these island leaders achieve these broader goals, largely through leveraging funding to support initiatives or coming up with different sort of ideas in how you could actually achieve various goals. Anyway, so essentially what it does is bring together people working towards collective impact. So as a partnership, and how we ended up developing a relationship a bit more with Socrata, was that we realized, we've now existed for 10 years, and we really needed to find a better way of sharing what we did and how we measured what we did. And it was a conversation that we'd had for years and years and years in terms of we've always had a sort of a dashboard tracker, which is an Excel spreadsheet, with maybe a PowerPoint at the end of it, so not that exciting. And that's how we ended up talking with Jeff and having Bindo and Christian support us in building an actual dashboard. So this is actually some of the our current dashboard now that you can see. Essentially, really focused on really our core goal tiles, so the number of islands that have made commitments. So that's, for example, the President of Palau and plus 4 other islands would be counted in that 33 as committing to this 30-20 conservation target. In funding leveraged, as a partnership, we've had more than $120 million channeled into island action, so supporting those leaders achieve those goals. GLISPA, or I do not have the $120 million. That is all in sustainable trust funds and other sort of trust funds, etc. But you can see, from being able to have this dashboard now, you can drill right into it. And other things. So, we also track how collaborative we are as a partnership and our sustainability. But I'll get a little bit more into that later because I don't want to.
All right, that's great. I mean, so, GLISPA, a sort of a network of organizations around the world, really focused on a pretty broad area, but sustainability for particularly island nations and island communities. Let's just switch gears for a second, if we can. Sorry.
So, and that's just the Aloha Plus dashboard.
From Hawaii.
Yeah,
right.
So.
Okay, let's switch gears. I'm going to have David have you take the control. As I said, David Saldivar, he's from Oxfam America, so you have a global NGO that has a similar sort of span of GLISPA, but actually it's a single organization that sort of touches a lot of the world. So David, please go ahead and...
Yeah, thanks, Jeff. And I'm really happy to have the chance to be here and talk to you about the way open data can have an impact for development that feels a little bit more tangible at the level where people live. And I just wanted to start off with a few images to kind of represent how Oxfam's trying to move in this area. So I work in the area of policy for effective foreign assistance. And so Jeff started off talking about impacts. So one of the things that my team focuses on is how can U.S. foreign assistance and the programs that are designed and implemented by some of the folks upstairs in this building can have the most impact for reducing poverty and reducing injustice and improving the quality of people's lives around the world. And Oxfam really believes that development is not something that happens by adding more stuff, but development is a quality that emerges from the compact between states and citizens, and that development is really driven by local leaders inside and outside government who are able to work together with the resources that they have at hand, whether those resources are domestically generated or support from international partners like the United States, to improve the quality of their own lives and make their societies more reflective of the way they want them to be. So this is Alfred Sirleaf in Monrovia, Liberia. And I should say at the outset that these aren't Oxfam stories. The stories that I'm selected here I chose because they represent the type of people that we try to work with when we take this approach to facilitating the use of information as a tool for development. So Alfred is the founder of the Daily Talk, which is an open data portal in Liberia, which he's standing in front of here, that takes the literal form of an actual chalkboard, but represents the aggregation of information from citizen and official sources from across the country that is consolidated and then transformed into a form that is most usable for the audience at hand. So Alfred and his staff, he's standing inside their newsroom. That chalkboard actually turns around to face the street and is located at one of the busiest intersections in Monrovia, so is viewed by thousands of people every day, and presents current, timely, useful information in a way that's most accessible to the types of people that are going to be seeing it there on the street. So in addition to presenting words and pictures, it also uses symbols and to make sure that they can connect with people who are non-readers. And it's all, at some level, informed and driven by data. So the format that he's using here is a form of a scorecard. And during the Ebola crisis, Alfred was one of many citizen-level outlets that was taking information from the government of Liberia, from humanitarian responders, and breaking it down into digestible nuggets of information that could really track how the government was responding to the crisis and how the resources that were available to combat the Ebola epidemic were being used, and whether citizens could have confidence that those efforts were being fruitful. And it's this use of information to empower people to engage through dialogue and intellectual engagement with their government rather than through conflict that is so critical in a situation like the Ebola crisis. So just another quick example. This is Katherine Malaga. Katherine is a community activist in Tanzania, and in 2010, she started working in the village of Chembu, which is on the border between Tanzania and Malawi. This is the Songwe River that's part of that border. And you can, can't tell if you can see in the picture, but there's actually a rope bridge spanning from that tree on the right across to the Malawi side. And the village that's about a 10-minute walk from this bridge had a health clinic constructed in it, but it had never been opened since the time it was built. And the closest the closest clinic on the Tanzania side was 12 kilometers away in the next village. But if you cross the bridge, there's one just 3 kilometers into Malawi. So what wound up happening is a lot of people in need of health services would wind up taking this bridge. So imagine if you're sick, or if you're injured, or if you're pregnant, having to go across this bridge to access health services in a whole other country when there's a government-run clinic facility in your own community that just doesn't happen to be functioning. So why is this an open data story? The reason is Katherine's job when she came to that community was to help to identify what the local priorities and needs were and what resources they had to go about getting those needs met. And so the first thing that they focused on was we have kind of half of a service. We've got a facility, but we don't have any actual staff or resources. So in order to resolve that problem, what they found was that they're really dealing with a problem of data quality. So the reason why that clinic hadn't opened was because it hadn't been logged properly into the Ministry of Health's records. So someone sitting in the capital in Dar had a spreadsheet with all of the village health facilities on it where this clinic wasn't represented. So that tells you that right off the bat, in order to engage with this problem and get the necessary resources brought to bear, Katherine and her colleagues needed a couple things. They needed access to information, and they needed some way to translate that information into a form that would be meaningful to the people that she was trying to organize and to support, and then take the information from those social settings and then translate it again into a form that would be usable to engage with the local health officials and on up the chain. So at each level, it's taking the data available, combining it with what other information is relevant, in this case the information, the qualitative information about people's needs, and then putting it into the form that's most useful. And we really think that in order for data to be an effective tool to accomplish the Sustainable Development Goals that Amparo mentioned in the previous presentation, it's this kind of dynamic that really needs to take hold. And I'm looking forward to talking about that with you.
Great, thank you. Much appreciated. Adi, we're going to jump to you right away. So please take the floor for a few minutes and tell us about Code for South Africa.
Right.
Yep, there you go.
Hi. I founded Code for South Africa. We're a civic tech organization. We started out being an open data advocacy group, and we very quickly realized that no one actually cares about data. So we had to go back and sit and think, okay, well, what do we do now? And realize what people really want is not data, but I think, as Jeff said in the previous session, they want answers to questions like, how much should I pay for my medicines? Where should I go? Where is my nearest hospital? What is the quality? All that sort of good stuff. And so we started focusing on driving the demand for data. There's no point in trying to lobby government to release a lot of data if people aren't going to use it. And certainly in South Africa, data literacy skills are much lower than they are, I suppose, here in the US. So we decided to divide our activities in 4 different areas. One of them is civil society, so working with organizations that have networks and grassroots communities, and working with them to help use data to do all the good stuff that they do. We don't see ourselves as doing the good stuff. We just help the do-gooders. We work with media. They have massive audiences, and how do we get media to be a lot more literate with regards to data? What we're trying to do is essentially get media to knock on the door of government and say, please, well, maybe not please, but give us your data. We also work with government in terms of some sort of supply. That's not really the interesting part. And lastly, it's around communities, getting people. So our grassroots are the techies and the activists and the journalists, etc. But getting those people to get more involved in data, understand how to use it. I'm going to speak to you about 3 projects quickly, which it's really just a sample of the type of work that we do, and it might give you a taste of what open data can do in a country like South Africa. So the first project was part of a larger program called the Southern African Regional Program on Access to Medicines. And it's a catchy name. We called it SARPAM. And it was divided into a number of projects. The one that we worked on was around information transparency. We ran a survey, and in the 15 SADC countries, so that's in Southern Africa, that's everything from South Africa all the way through to DRC and Tanzania. And we looked at 50 essential medicines, everything from HIV, TB, malaria, maternal child health, etc. And we compared the prices across countries, and we saw that in 60% of the cases, the ratio of this is public sector, by the way, the ratio of the highest price paid to the lowest price paid was 5 times or more. So one country might be paying $10, another $50.
For the same medicine?
For the same medicine. It's complex, so I'm not going to go into the nitty-gritties of pharmaceuticals, but in many cases, and I'll show you an example just now, where a lot of money could actually be saved. Not surprisingly, every one of these countries has a procurement act which basically says that all medicines that are purchased by the state should, at least all the tender awards should be made public. So the obvious thing is, why don't we just collect all the tender awards and put them in one database? Any technical person in the audience would say, yeah, that's a great idea. Let's spend 5 minutes, clean up the data, and put it in a database. Done. It took me 2 years. Because I had to fly to each one of the countries and speak with the permanent secretaries and get the permission and get to the head of pharmaceuticals, etc., and finally get to that techie in the back room and access the database and get the data. Because even though data is meant to be public, public might mean posted on the door of the procurement office for 2 hours and take it off. So getting the data was really difficult, despite the fact that it should be easily accessible. Anyway, so what you have on the screen over there is just an example of the South African tender awards. This is the best data we have. This is a nice PDF, which this is, out of all the countries, South Africa had the best, which was really just a PDF that you had to search for. Anyway, what happens if we put the data for each one of these countries in one place? We have this this tool over here. So in this case, we're looking at ciprofloxacin, which is an antibiotic, and we compared the prices paid across the region. And you'll see there that, just look at the graph at the bottom, you don't need to worry about the numbers, but you can see that Mozambique, which is the fourth one down, is paying, I don't know what that is, a fifth, a sixth, a seventh of Angola. Seychelles, which is a country with, I think it's around 90,000 people, pays less than South Africa, a country of 55 million people. So it's economies of scale don't necessarily work here. The marketplace is really, really complex. But when you see a graph like this, you can't argue that, well, there might be, Seychelles might have a port, say, or it's an island-based country versus Botswana, say, that's landlocked. Those types of logistical price differences would account for 10, 20, 30%, but we're not talking about 500% price differences. Here's one of the success stories we had from the project. Okay, success story from SARP and price information sharing. We used the 10 Rand, this is Botswana, from their procurement office. We used the 10 Rand tender price in South Africa to push bear for a lower price. We're currently paying 99 Rand per pack, but we've paid as high as 152 Rand in the past. So, I mean, that's 15 times. This will amount to saving around 10 million pula per year, which is $1.5 million US annually. And that money can then be channeled to pay for more medicines, more ARVs, or whatever the case is. So for me, this is quite powerful. We didn't need to change any laws. We didn't have to do anything crazy. All we needed to do is put a couple of numbers in one place and show people that they're actually paying too much. This, by the way, was exactly the same medicine, in the same box, same company. It wasn't a generic or anything like that. So there's absolutely no reason why Botswana was paying so much. Staying with pharmaceuticals, how about the private sector? What can we tell about the private sector? The Department of Health in South Africa publishes a file. Well, in South Africa, medicine prices are regulated, so there's a maximum price you should be paying. On top of that, there's a very complex formula in terms of the dispensing fee. So on top of that regulated price, the pharmacist is allowed to charge X% plus Y Rand, etc., depending on the price of the medicine. Now, the Department of Health publishes this Excel spreadsheet on a website which no one knows about. It's hidden somewhere at the bottom. It's very, very difficult to get a hold of. And it's not accessible. It's an Excel spreadsheet. So now, how do we package this data in a way that ordinary people can actually use? So what we did is we developed a very basic tool where you could type in the name of your medicine, either the generic name or the branded medicine, and it will give you the list of all of the medicines which have the same ingredient, and it'll show you all the price, all of them by price. So for instance, if you search for Lamictal, which is a mood stabilizer, you'll see that Lamictal, which is the branded medicine, will cost you 840 Rand a month. Just rands, divide that by 10. It's actually 14. Divide that by 10 to get dollars. And the cheapest is 200. So the price difference is 4 times between the cheapest generic and the most expensive. Here's an email we received from a doctor. One of my own patients, okay, never mind. I work in a mixed income neighborhood, and being able to figure out what works for my patient's budget is extremely helpful. There's no point in prescribing medicine the patient cannot afford to buy. Please keep up the good work. By the way, we didn't publicize this at all. It was just word of mouth. We see the numbers increasing. We really should do something about advertising the thing. But we see this all the time, where we have people coming back day after day after day after day, using the tool, looking for generics, looking for cheaper prices. Initially, I thought, well, this just targets the middle class, people just trying to save a little bit of money on their pharmaceuticals. Of course, this email tells you something different, but also the very poor who usually go to public clinics, sometimes due to stockouts, have to go to private pharmacies and spend a large percentage of their income on pharmaceuticals. One last example. This is around helping people better understand. In this case, it's domestic worker wages, and figure out how much they should be paying in terms of salary. So South Africa historically is a very divided country. We have high levels of unemployment. Domestic workers account for 6.7% of the workforce, and they're one of the most exploited sectors of the population. There's no price bargaining. It's a take it or leave it situation. And so what usually happens is that employers set the price, and the way that they decide how much to pay is based on the going rate. So they ask their friends, their families, their neighbors, how much do you pay? And then they use that as a basis for their own, for what they pay. The reality is that it costs a lot of money to live in South Africa, even if you're poor. So if you're earning 3,000 Rand a month, that doesn't mean that that food is much cheaper. The inflation rate is quite high for food, and if you're earning 3,000 Rand a month, you are spending about 50% of your salary just on food. What we did is we developed a tool where people could input how much they currently pay, and then we made a few assumptions in terms of what are the inputs into what a domestic worker would be paying for, is food, transport, healthcare, education, etc. And we'd give them some defaults, but then they could play around with the figures. So if we said, well, 27 Rand a day is the minimum amount of that you can spend to get 2,000 calories on a very, very poor quality diet. You could decide, well, 27 Rand is a poor assumption. Let me move it up to 35 Rand, look at transport, all that sort of thing. So the employees could play around with this calculator and come up with a figure. And usually what happens is you see that's what you currently pay and what you should be paying based on your own assumptions is wildly different. We published this in one of the national newspapers, and the result was overwhelming. It just, somehow we just managed to, we hit on a nerve in South Africa. There were tens of thousands of users in the first 2 days, and it was republished months later, and we had exactly the same response. Hundreds of comments, most of them angry, because people were saying, why are you dictating the minimum wage? We're not saying anything about minimum wage. You gave us the figures, we just calculate based on your figures. So these are three different tools which I think are quite useful in the sense that it's not just an app in terms of where is my nearest recycling plant, which is important, but rather here is some data, use it to make your own decisions, and hopefully that'll improve your life in some way.
That's great. As you can tell, I mean, you've got sort of a very rich diversity of experiences because obviously the three organizations here do very different things in a lot of ways. I thought maybe we'd just do a quick sort of round of questions to let you sort of kind of like elaborate a little bit in some specific ways. I mean, so for Jessica, you know, one of the things that, at least from the outside, about GLISPA as a network sort of being more data-driven and how it sets goals and how it shares the data around what it's doing is, you know, I'm curious, and I think it'd be interesting for you to share, just take a quick minute to sort of, how has that actually changed how GLISPA itself thinks about its work, looks at its operations, sets goals? I mean, has it had an effect on the organization itself? I mean, we've talked about impact on people's lives. That's obviously first and foremost. But on the organization itself, has it changed the organization in any way?
Yes, it has. So essentially, GLISPA, over the last 10 years, our strategy has pretty much remained around the three core goals, around this inspiring leadership and catalyzing commitments and facilitating collaboration. One thing that we realized in going through the process of developing the dashboard was that we didn't necessarily have, measurable goals for each of the goal areas. So we had broader sort of goals that we're aiming for, but not a specific quantitative target associated to each of the goal elements. So actually, as of last week, we just had our steering committee meeting in which, we went through a process of saying, well, actually, in inspiring leadership and also catalyzing commitments was easier because you can have it's essentially how much funding
count the money
up. And so that one was quite clear, but the other elements, we really had to sit down and be like, exactly what are we meaning by facilitating collaboration? Exactly what do we mean by supporting successful implementation of these commitments? So there's some also big questions that we really need to still dig into, and as we have more, as we're starting to work more with also the other commitments that have been launched, so for example, the Micronesia Challenge and the Aloha Plus Challenge that I mentioned earlier, we are able to then start start really tackling some of the difficult questions about what does success look like, which in conservation, you may be able to declare a protected area, for example, but that doesn't mean that is increasing the biomass of fish, or it doesn't mean that it's actually protecting the natural resources. So there's a lot to go there.
And are you depending on or participating organizations to sort of take that level of impact? I mean, that's not the level that you work at, right?
That's not the level that we work at. So yeah, exactly. We have, within our partnership, we really have a niche which is around this inspiring leadership and also the catalyzing commitments piece. However, we work very closely with the commitments that are launched through the partnership to then help them also think about how they can tackle the similar problems. So in us all collectively trying to tackle these issues and coming at it from different sides of the coin. So in Micronesia, for example, they're really on the ground and in the midst of it. They have different ways of thinking about what success looks like to then Hawaii or the Caribbean.
Right.
And so with this conversation going on, ultimately we will, I think, have a really strong and potentially different set of measures, but a strong story at that regional and global levels around what success looks like towards goals.
Right.
So.
David, you know the stories you told sort of are really right on the ground. I'm just wondering sort of the challenges of being Oxfam America, sort of a large nonprofit, actually having data that has impact to those people, from you, Oxfam, to them. Like, how does that work? Like, what are the challenges of like you having that kind of impact as Oxfam?
I mean, I think one of the challenges that we're experiencing as an organization, both here in the U.S. and then worldwide as part of the Global Confederation, is making those leaps from those different levels. So the people that do the kind of programming that support Alfred and Katherine and people like that will have a certain set of data that they use in their day-to-day work. And you see the same thing at the mission level inside USAID. Then regionally, the people that are kind of designing strategies and programs to do an integrated program across several nation area are looking at different data, and then you get all the way to those of us working in national capitals. It's different as well, and then you also have to split off, the kind of budget and financial data that sometimes lives in a completely separate world from the programs data. So that's really where it comes to a head for us, because we feel like if at this level we can intelligently combine the budget data with the programs and results information in a way that feeds back into how decisions get made about programming, informed by learning from the ground, but also across regional experience, then that's really making the data solve problems for us the way that we've been talking about. And so it's not just the focus is no longer on look how transparent we are, but it's about getting better results from the work.
Mm-hmm. Adi, the three examples that you gave, each of them in a different way had some very practical impact. The impact on government savings, impact on people, sort of the price they're prescribing medicine that people can afford. But I'm curious, especially in the context of South Africa, because it'll probably be a bit different than here we experience in the U.S. What are the key challenges of sort of turning data into something that's actually useful? I mean, you sort of play a middle role, I think, as sort of civic technologists. But, I think it'd be interesting to share sort of like, what are the key things that data coming to you and data getting out to someone in a way they can use? Like, what's the hardest part? What's the key thing that sort of you need to be doing?
I think you mentioned it in the previous session. You're saying that your grandmother doesn't need to know anything about open data.
Mine doesn't, that's for sure.
And I think intermediaries, and we've spoken about that over the last couple of years, that intermediaries are quite important, incredibly important in the open data space. The challenge that we have is the intermediaries are not very strong in general. At least we don't have enough. The data literacy in general across the population is quite low. And part of our job is to show people data has power, that there are many stories to be found in data, and we try to get people to love data and to show them that it's not just an Excel spreadsheet with a bunch of numbers. Even the most boring data set has something very interesting to tell you. And so in terms of challenges, it's really strengthening that middle layer of intermediaries who can then reach out to the end users, the grassroots, etc. That's really where we focus our efforts.
Okay. I've gotten the signal we're out of time, and I, even though we started late, so I feel like we're getting cheated a little bit, honestly. I'm wondering if we can beg indulgence and see if anybody would like to actually ask one question. Are we able to do that?
There's another session if you guys want to leave in the amphitheater, but if you guys want to stay around.
Right, because no one's bumping us out of this room, right?
That is correct.
Okay. So, all right. So anybody who'd like to sort of bid farewell and go to a session that's starting in another place, please feel free, of course. If there's anybody that would like to sort of make a comment, ask a question, since we're not going to be bumped, and if we're able to just take a couple minutes, please feel free. It's a little bit hard for me to see, and if there are no questions, that's fine. You can obviously come up in person if not. But anybody comments or questions? Please go ahead. I don't have a mic, but it's a small room, so if you speak up or I'll repeat it.
Talk loud, it's fine. I'm curious at this point, you're such unique visions and outreaches. How can people who are stateside help? I know I'm familiar with Oxfam, of course I can donate money, but for something like Code for Africa, what are my options?
Well, I mean, you each can sort of take a crack at that. It's someone offering help, so.
So just explain to me where are you from? What?
Well, I'm from Seattle, but I am curious in general, just like what people can do to help each one of your organizations and what the options are.
I think from our point of view, we deal with governments who don't yet have the vision, I suppose. I think just learning from other governments that have moved forward and have actually seen results, that's I think that would be quite valuable. Certainly from a civil society point of view, that's one of our big challenges. We work with media and other civil society and communities, but working at the government level is quite difficult. So I suppose if that were possible, I'm not sure if it is, I think that would be very valuable.
Is there anything that you kind of crowdsource help on? For example, where, it's work that's just going to go beyond the hands that, for example, Code for South Africa itself might be doing? And that could be locally. I mean, I'm not suggesting it has to be international, but one of the things is sort of leveraging our networks of people who can donate little pieces of time to do kind of discrete little tasks.
Yeah.
I remember myself trying to sort of gather some photos for your protest data,
Right.
for example, from major media.
Yeah, it's actually been quite that project's been recreated so many times. Everyone seems to think it's a really sexy project, but no one's gotten the photos yet. So, Jeff, if you want to donate a bit more of your...
No, I think one of the answers could be, for a lot of organizations, particularly in civil society, what they're trying to do is so much bigger than what they're able to do alone, right? It's obvious. Mm-hmm. And the idea of being able, because of technology, to be able to sort of crowdsource bits of help, not just dollars, but actually people's time on some discrete things. And so maybe, one answer is to sort of explore whether that kind of assistance on some very targeted kinds of things they do, a particular project, a particular kind of data you're trying to get out there. I could imagine, I'm not speaking for him, but I could imagine that being true in a number of different ways. And Jessica, please feel free.
For GLISPA, we do accept money. So you can donate through Global Giving, always greatly appreciated. But also, on a more technical level, we're an open partnership, open to anyone that wants to help and support our mission. And so, we can literally, if you were interested, for example, in open data, then you could help us, or help me, think about how we can sort of use open data more. We also work with, these several commitments and countries internationally. And so, we have placed, what we call GLISPA fellows into, Micronesia and really quite beautiful locations to do very hard data work, and other such things. So I think my contact details.
You weren't just offering a trip to some tropical island, were you?
One of our recent fellows was just there for 3 months, and
You don't like beaches. You're raising your hand. I know for a fact that guy back there, he doesn't like beaches. David, for Oxfam?
I think it's a great question, and I think actually an event like this has a pretty good point towards the answer. One of the things I've found working in this area here in Washington, D.C., and working with the federal government and working in international development is that a lot of the learning and kind of good practices and just ways of working that have been developed in the civic tech community, in the technology industry in general, about starting with a good, robust mapping of user needs, working iteratively, not designing to a preconceived idea of the problem. A lot of that has been woefully underutilized in this field when it comes to designing data solutions for development problems. And it's not rocket science. It's the same sort of thing that if, I imagine a lot of people that are here over today and tomorrow work on the same sorts of issues that the people in my slides work on in their home communities. About getting governments to make better decisions and use information as an asset and be more responsive to people's needs. And I think what we're starting to see now is there's more of a channel for folks like you to engage around how data is used as an asset in the development world. So for example, at the UN last month, there was the launch of a new initiative with a perfect international development title called the Global Partnership for Sustainable Development Data. It doesn't make a great acronym, so that probably should be first thing on the agenda. But the point is, one of the things that they're trying to do with this is another multi-stakeholder government, non-government, private sector initiative, is to try to get actors in the open data space who haven't currently been connected up to the world of international development to speak what they've learned and start to kind of join some of these conversations. So I think there's a great deal of just advice and guidance that the civic tech and technology sector could offer, just as far as what questions to ask, and treating the problem that confronts somebody in Monrovia with the same degree of curiousness about and lack of preconceived idea of a solution as you would in Seattle or Austin, because it's really the same forces at work. And I think in addition to just kind of as a supporter of various nonprofit organizations that work in the space, I mean, and in addition to things like crowdsourcing of work and using kind of actual technical ability, finding the open channels to kind of give your thoughts is something that's, I think there's starting to be an audience for, and it's definitely needed.
Okay. Thank you very much. Even if there's another question, we'll cut it off and be somewhat mindful of the fact that we've actually, in my calculation, ended exactly on time. Thank you so much. Appreciate it. Thank you, everybody, for coming. Thank you for joining us.